Hello to everyone joining today, and thanks for tuning in. I am Dr. Mo Al-Khalaf, a postdoctoral research fellow here at the University of Ottawa Heart Institute, and I am back as your host for today's episode of BEaTS Research Radio, a YouTube channel and podcast streamed normally from an active lab at the Ottawa Heart Institute. Our goal at BEaTS Research Radio is to communicate science to the community. Our guest today is Dr. Peter Liu, Professor of Medicine at both the University of Ottawa and University of Toronto, Chief Scientific Officer and Vice President of Research at the University of Ottawa Heart Institute, and the Director of the Cardiac Function Lab, which also makes him my direct boss. Thank you so much, Peter, for joining us today. It's always a pleasure to chat with you, and today you and I get to do it on camera.
Great. Thank you very much. Yeah,
thank you.
I really appreciate it.
Yeah, while we can have many deep and insightful discussions about cardiovascular health and research with Dr. Liu, today's focus will be primarily related to the science underlying COVID-19, implications for the cardiovascular system, which also happens to be the title of the latest review published by Peter Liu and colleagues in the journal Circulation 3 months ago, as the world was just beginning to understand more about the current pandemic. Before we delve into the biology, Peter, our first question is, what do you think has made Canada one of the few countries in the Americas able to contain and effectively respond to the pandemic?
Yeah, so thanks so much, Mo, and this is a great opportunity for us really to discuss, sort of a topic that's top of mind, certainly for many people, in the community. Yes, I think in Canada, we are being very fortunate, certainly compared to many other countries around the world, in fact, doing very well. And certainly my American colleagues are very, very jealous, and they're calling up to see how they can sneak across the border so they can be safer. I think there are probably at least three factors, but there obviously is a convergence of many aspects that allow this to happen. So I think the first one is the fact that the political leaders that we have are very much aligned with the scientific leaders in terms of the direction, right? Speak with one voice. Many of the press conferences, involve the leaders, but together with the head of the public health, and so that the policies that's actually promoted, transmitted to the public are one and the same. So there is no mix up in terms of messages. This is obviously not the case, south of the border, and that's the confusion, and people don't know whether one should actually, wear a mask or not. And then the second aspect, I think it has to do with how much I call the social consciousness, of the population. And that is that because when you wear a mask, it's not that necessary for yourself, right? You're actually doing this for the greater good of the society, so that you, even if you may have asymptomatic transmission, infection and may transmit, you're doing this so that you can actually protect others. It's, for our grandparents, who may be particularly at risk. And it's really thinking of others. And I think Canadians are much more socially conscious from that point of view, rather than say, hey, this is me first, but it's important to remember that we're in this together. And so the third aspect is the public health system. And so I think, in Canada, we have, fortunately, kind of a public paid system in which there's good ability to, do contact tracing and things like that. Whereas in the US, it's kind of free for all, very fragmented, and therefore it's not possible to do that. I think these are probably, some of the important factors, and we certainly want to continue to do that, as the risk for second wave is always around the corner.
That's exactly right, and I'll highlight exactly what you mentioned there, Dr. Liu, is the being on the same page from the political and the health sides is really, really important, and that did help us a lot with moving through the stages and responding as accurately as we can, and adapting to the changes in the knowledge that we gained from the beginning all the way to where we are right now. So I think we'll tackle now some of the science related to COVID-19. We'll start with, could you share with us some of what is known to be impactful effects of COVID-19 on the heart and lung?
Absolutely. Of course, this is very much a moving field. We are learning about this every day. Of course, it's only been with us, for less than 7 months. But it's amazing how much knowledge has been accumulated. And I think there are some very unique aspects, to this virus and the infection that we're learning all the time. The first one is the fact that this virus, whether it's with the recent mutation or how it's evolved, is very sticky. And so that it's very infectious. And so this is much more than what we have previously, appreciated, whether it was SARS or with even the flu. And the second aspect is really understanding that this virus uses a particularly a special receptor, and that's the angiotensin converting enzyme 2 receptor, which is part of the renin-angiotensin system, more present, for example, in patients with cardiovascular disease. But because this receptor is in the nasopharynx, in the lung, in the heart, in the gut, that's where the virus tend to actually end up and the symptoms. The third aspect is really the interaction with the immune system. And so we know that, the virus, the same virus, but different people have totally different outcomes. And this has to do with what one's immune system does with the virus. And so if the immune system is able to attenuate the virus effectively without causing complications, you have a good outcome, which is a majority case. But then some patients end up not being able to deal with the virus appropriately, have a huge amount of immune response that end up actually hurting the patient. So I think those are some of the unique aspects of the virus that really now is underpinning sort of the diversity of clinical picture that we see.
Yeah, and it's so important to in fact spotlight the fact that the immune system response is probably one of the major drivers of the diversity of the reaction to COVID-19, because the immune response is so different from individual to individual. Whether it's just the genetics as well as the lifestyle that an individual leads will very directly affect how the immune system of that individual is set up. And that could definitely affect how the response to a viral infection that will immediately react to with the immune system could lead in one direction or the other. Another important area of focus now and in the coming years is the fact that COVID-19 seems to affect the biology of blood. Dr. Liu, could you share some light with us regarding how SARS-CoV-2 appears to affect blood biology?
Yeah, so I can talk to this about from 2 points of view. One is on the coagulation or blood clotting aspect. The other aspect is actually what you mentioned earlier. That is for example, the immune system or the white cell profile. And so it's the surprising part that people have realized looking at the patients, with COVID-19 was the propensity for blood clotting. There has been actually reports of, getting a blood sample of the patient, just from the vein. And in fact, by the time the blood is in the tube, it's clotted. It's just unbelievable. And so it has turned out that you can get the blood clotting in the small vessels that can actually, lead to kidney failure, lead to lung failure, or big clots, that can block the lung. And so some of the patients who get hypoxic is because of big blood clot. And this likely comes from 2 factors. One is the fact that the virus appears to be able to infect the endothelial cells or the lining, of the blood vessels. So it produces an inflammation, which then causes a rough surface that can actually increase the propensity for clotting. Our pipes, in terms of the blood vessel, is usually nice and clean and smooth. And when you have inflammation, we call the vasculitis, you can actually then get blood to stick and then increase the clotting. And then the other aspect we mentioned earlier, has to do with the inflammation and the renin-angiotensin system, which you can get activated, which also predispose the individual for blood clotting. And therefore, now we realize that these patients need to be protected with blood thinners. The other aspect is actually on the immune system, if we can follow up on that just momentarily. And it turns out that in the immune system, we have a very old system we call the innate immunity, that's been sort of there, in evolution from the single cell organisms. Everybody has that. So it's really a fairly powerful system, but it's not very precise. But the more modern system are the acquired immunity, we call, for example, the T cells and B cells. So they are much more precise. They target, the causative factor or the antigen. Is like a smart bomb. And so it turns out that when we are younger, so we're talking about who has the risk. Younger folks, have very well developed T cell system, and so younger folks can actually target very precisely in terms of the virus activation, can produce the appropriate protective factors like interferon, and also have the ability to lead to B cell production, lead to memory, immune memory, which is so important, when we're talking about vaccination. So younger people can deal with this very precisely, and because this is a system that is very active, and so young folks tend to do well. But on the other hand, when you get older, you develop what we call the immune senescence, in which the immune system is getting older. So the T cell system gets a little tired out. So you are much more dependent on the innate immune system, which are your neutrophils, your macrophages in the blood. And unfortunately, they're not so precise, so they can't get rid of the virus so effectively. And so sometimes they go into an overdrive. But it turns out the people with heart disease, with diabetes, with obesity, this is kind of already revved up in that direction. And so you end up with older folks, patients, with cardiovascular disease or risk factors, having propensity for this older immune system to deal with the virus. And so sometimes they go into an overdrive, produce what we call a cytokine storm, and which leads to organ failure and the death. And so this is probably accounting for the clinical diversity that we see in terms of response.
That's exactly. In fact, Dr. Liu, you went right into the next question that I was going to bring up, which is exactly the question that maybe a lot of folks in the general public have when it comes to COVID-19, which is what is the underlying reason for the majority of COVID-19 patients being able to recover and not need hospitalization, but then a distinct and non-trivial number need not just hospitalization, but intensive care in the ICU and a high degree of intervention to treat them? What could be the cause for this type of diverse biological response?
Yeah, so one factor we mentioned earlier is definitely the immune system. So younger people have more precise, smart system, we call it, like the T cell system, and the older folks don't have that. But the other counterpart that complement this is actually the presence of the ACE2 receptor. So it turns out, for example, very young children don't have much ACE2 receptor. So they don't get infected as easily. And I guess that's why, people say that the school may be able to cautiously open, especially at the kindergarten primary level. But it turns out as we get older, and particularly as we have more risk factors, there's been now studies to show that when you have, whether it's heart failure, when you have diabetes, your ACE2 receptor levels go up. And so in that situation, you have kind of the worst of all combinations, right? So patients, let's say with diabetes, with heart disease, have more receptors to get the virus and have an immune system that's kind of inappropriate to deal with the virus. So you get, a terrible toll versus, the younger individual have much fewer receptors and have a very, very effective immune system. And therefore, you can deal with the virus very effectively. And I think this is a really, the virus really exaggerates, this is kind of the diverse susceptibility of the population.
Yeah, and other aspects, Dr. Liu, that we don't have maybe the data recorded for it, but these are probably ongoing assessments, is the effect of things such as smoking, such as hypertension, obesity, as you mentioned. There are so many other cultural and societal factors that probably exacerbate this diverse and different response to COVID-19 that it's upon us, I believe, the healthcare researchers and healthcare system to understand and provide more definitive answers to the public. And that's where we're all heading in terms of our research, not just for COVID-19, but I believe like in general, COVID-19 is one is the current pandemic we're dealing with, but I believe infectious disease is probably now understood more to be a risk on the society and globally moving forward. I believe, is that the way you see it as well?
Yes, absolutely. Yeah. So COVID-19, so there's no question that there's already inequity, social, economic, sort of differences, in different populations, in different neighborhoods. And so we previously kind of patched things over, but COVID-19 really shine a whole light, right? Bring into relief of all these differences. So especially in the US, for example, you see the Black Latinos who tend to be socioeconomically disadvantaged, who tend to have more of these risk factors. They are the ones really taking the big toll by this condition, and really identifies the critical need for that. In Canada, it tends to be the elderly, who are in the senior homes or long-term care homes, who have the highest risk and the most unable to protect themselves. And they're the ones, really taking the toll. So I think it really kind of magnifies where some of the societal challenges are as well. And really forces us to focus, on some of these issues that's beyond just, kind of a viral infection itself.
That's exactly right. That's exactly right. So the next question here is now looking forward, now projecting into the future. In what ways did COVID-19 and the global response redirect the way healthcare goals are set and future research in general? We've seen a significant shift in the way new research is disseminated. Do you see this as the new normal, and what do you expect the moving forward things can be like?
Yeah, so again, the COVID-19 really forces us to relook at the research. And so the positive aspect is the fact that it brings a lot of collaboration in a very timely fashion, so that the people are working together. You can see how fast the genome gets sequenced, shared around the world, and how collaborative, people are doing clinical trials, over 2,000 trials. And of course, the whole vaccine effort, there's been unprecedented amount of collaboration, in terms of doing this and trying to do this in record time. But in this rush, every so often, little kind of things gets neglected. So people are really in a rush to actually, share the discoveries, with the world. So there are a lot of these, I guess, preprint servers, for example, in which publications are already posted, but without peer review. And we know that some of these, in fact, has created confusion, and because, there could be errors in them. And even some published data were not reviewed properly and had to be withdrawn or retracted. So it really caused a lot of damage, to the credibility. So I think that's one aspect. And then the other strange thing that we sometimes get is that the studies are done and all you have is actually a press release. You actually don't have a paper. And, what do you do?
Dexamethasone, so we're waiting for it, right?
Exactly, we're still waiting, yeah. You hear rumors, but what do you do in the meantime, right? And so I think these are some of the fixes that we need to actually put into the system while preserving some of the positive aspects.
Yeah, that's exactly right. And so you can see how like this is a double-edged sword. In one case, we are having the ability to collaborate and share data and increase the speed of research, but science is a patient field, is a field where the more time you provide it so that you can replicate and increase the data analysis and measurement and increase the quality of assessment, the better the results are. And that doesn't mean forever. That sometimes just means 6 months instead of 2 months, right? And with that, I think we reached our final question, Dr. Liu. And this final question is always a way to sort of provide some information to our audience. And the way I will state it is, could you share with us and the audience at least one pearl of wisdom that you can that can provide some direction or understanding when it comes to the response to COVID-19? What do you think is coming up in the next year or two that we all need to be more informed about to better prepare and be heart healthy?
Yeah, so thank you for that opportunity. So I think the lessons we learned already, and of course the future yet to evolve, is that the COVID-19 is here to stay. This is going to be the new normal. If we think that we're going to actually then, in a year's time, turn off all this and return to what it was, back in 2019, we'll never be there. Yeah, so the new normal is going to be, or we live, in fact, with COVID-19, even when the vaccine is available. But it does actually bring forward a lot of kind of a new way of doing things. It forces us to re-examine many of the aspects. But nevertheless, the basic health measures are still going to be critical. So that's including wearing of masks, in public areas, physical distancing, hygiene practices, and those is going to be, something that we as a society going to be need to accept and practice. But there will be also other ways in which we do things differently. We talk about collaboration, right? Collaboration is going to be much more urgent as we do things together. There will be differences in terms of how we actually share information, how we work, how we sort of meet. In that there is going to be much more virtual type of connections, and telework from home, even including some components of research, is going to be the reality. And in terms of meetings, it's probably going to be hybrid, but there's probably going to be much more efficient ways in which we can share information and making advances. So I think at the end of the day, it's going to be a new era in which there is a greater degree of collaboration, coordination, and we work, as part of a societal whole for the greater good, rather than, sort of just looking after our front door, so to speak. Yeah, so I think it's a new era.
That's and we're showing an example of that right now, Dr. Liu. You and I normally could be in the same room having this conversation, and instead now we've adapted to a more virtual setting as needed. And like you said, there will be a hybrid interactions where sometimes a more face-to-face interaction is possible, and sometimes it is more virtual. And yeah, in terms of the society's increased awareness of infectious disease and just integrating into our daily lives these new ways to interact and be vigilant is definitely, I believe, something that we should carry forward beyond 2020 as we move on into the future. Thank you so much for that. This concludes our interview, Dr. Liu. Once again, I'd like to thank our guest, Dr. Peter Liu, for coming on our program and speaking to us about all the important and timely topics we covered today. And more personally, thanks, Peter, for the everyday mentorship you provide me as an early career scientist working with you and our fantastic team. This is the end. BEaTS Research Radio is supported by BEaTS Research Lab, the University of Ottawa Heart Institute, and the Department of Biochemistry, Microbiology, and Immunology in the Faculty of Medicine at the University of Ottawa. Our AV producer is Alex Ross, and our director is Dr. Emilio Alarcon. Thank you all for tuning in. Don't forget to subscribe to the YouTube and podcast channels, and we'll see you again soon with another Science to the Community episode. Thank you.